Hi, I'm Dr. Marty Prince.
And I'm Danielle Moat, nurse practitioner.
We're here to discuss asthma today and provide some asthma education.
Dr. Prince, tell us more about what asthma is.
Asthma is a chronic inflammatory disorder of the lung. This inflammation affects small and medium-sized airways or breathing tubes, and it produces a combination of things: swelling of the airway, too much mucus production in the airway, and spasm or constriction of the airways. A combination of these things produces wheeze, cough, and shortness of breath, which are the characteristic symptoms that you experience when you have asthma. A number of things tend to make asthma worse, and they're referred to as asthma triggers. And Danielle's going to discuss a few of those.
There are a wide range of triggers that affect your asthma control. They're anywhere from seasonal allergies, such as pollen, dust in our environment, and different types of dander, including cockroaches, rodents, animals, cats and dogs, as well as smoke, specifically cigarette smoke.
We've talked about what asthma is. We've talked about the triggers that make asthma worse. Now we're going to spend a few minutes talking about how we manage your asthma. There are a number of medications that we provide to treat this disease, and Danielle is going to go over a few of the devices that we use to help you administer these medicines effectively. So first we'll talk about meter dose inhalers.
So when you first meet with your provider and talk about asthma, they'll talk about different medications to help control your symptoms. There are controller medications that are longer acting to help control inflammation, and then you have your short acting or rescue medication to help bronchodilate if you experience bronchoconstriction. The first type of device that comes in controller form as well as rescue form is called an HFA device, where simply you pop off. This is the mouthpiece, and this is where you activate your medication. It will puff, and you will see medication disperse. If you are using a controller medication, you'll be told how many times a day to use this. If it is a rescue medication, you will simply use it as needed.
An important point is if you're using a controller medication, you have to use this every day. It has to be consistently taken to be effective. And one of the major problems people have in having poor asthma control is using their controller medications intermittently, which leads to ineffective control of the inflammation of the lung and continued asthma symptoms. Next devices are a combination of either a dry powder inhaler or a different device that delivers a mist to deliver asthma medications.
So this next device is a dried powder inhaler. This device looks much different than our HFA device. To use it, you simply open the top. This is your mouthpiece. You would exhale normally, seal your lips, and breathe in deep and hold it. When you close the device, it will be ready for you to open it and activate your medication the next time you're supposed to use your controlled medication. Dry powder inhalers are convenient because you don't have to coordinate your press and inhalation.
This device?
This is called a Respimat device. This device comes in controller medication. It also comes in a short-acting medication called Combivent. Respimat device is a 3-step device. You twist, you open, and then pressing this button will dispel the medication. This will be your mouthpiece that you will put on your mouth and activate your medication and breathe in.
It's important to remember that once you use these medications, once you're done, you need to rinse your mouth out to avoid complications that can develop, most commonly the development of a thrush infection in the mouth, which is easily prevented by simply rinsing your mouth after you use the medication. We've discussed asthma triggers and we've discussed asthma medications. Now we're going to talk about monitoring your asthma. To do this, we use a device called a peak flow meter, and Danielle's going to demonstrate this and discuss how you use it.
So a peak flow meter is a simple way for you to track your asthma control. It is really best when you get your first peak flow meter that you blow into it 3 times and take your best number. This is considered your personal best. This is a good way to track when you're having uncontrolled asthma symptoms, what number does it correlate with. To utilize the device, you want to take a deep breath, seal your lips, and blow out as hard as you can. It may take a couple attempts for it to feel comfortable, but you'll get the hang of it, and then we would like you to track your peak flow meter daily. So, Asthma Action Plan will take your personal best, and it will designate certain zones, color zones. We have green zone, yellow zone, red zone. If you are in the green zone, you will be 80 to 100% of your personal best peak flow. If you start to have uncontrolled symptoms or your numbers start to drop into a different colored zone, that is the time you need to call your provider and follow the instructions on your Asthma Action Plan. We have green zone, which is 80 to 100%, yellow zone, which is 50 to 79% of your personal best, and then 50% less, that is a red zone, and you definitely need to call your healthcare provider. An asthma action plan is very important, especially if you've been first diagnosed with asthma, so that you can better manage your symptoms.
Okay, we've discussed what asthma is, we've discussed asthma triggers, we've discussed medications and strategies for managing your asthma, including using a peak flow meter and an asthma action plan. In many asthmatics, using basic medications provides adequate control of your asthma so you can function day to day just like anyone else. There are a few people who have more severe asthma that is not controlled with standard medications, and for those individuals we recommend the use of a number of drugs called asthma biologics. Asthma biologics are monoclonal antibodies that are tailored to block or inhibit the inflammatory cascade in specific sites that help decrease inflammation and can make it possible for your asthma to be completely controlled in addition to using your basic medicines.